Hey everybody, it's me, your girl, Passion for Life. I had my second um spinal epidural injection today, and I just want to give you a little journey on what happened the first day, which was Wednesday of this week, and then I had one today that was which is Friday. So, when I initially went and they told me that I was gonna have it done, she told me that I could have some mild sedation, which I opted for because my nerves stay on edge. I don't like needles. I don't like pain. I have been looking at people on YouTube and the procedures and the needles that they use and all that, and they are pretty big. So both days when I went in, checked in, they did my temperature, and once you sign the authorization for them to do the actual um, procedure, they'll ask you, do you want the sedative? And depending on whether you say yes or no, they'll put like a little code or something at the top. So the first time when I went in, she checked my vital signs. My blood pressure was a little high, but that probably because I was nervous. And I can't remember exactly what it was. It was a little high. So she told me that she was gonna get my sedative. Did I want it in my hip or my she said, do you want it in your butt or your arm? And I said, I want it in my arm. And she said, right or left? And I said, right. I don't know. I tend to get more injections in my arm, in my right arm, more than the left. I think in my mind, some kind of way, it's gonna hurt more than the left. But anyway, so before she gave me the injection, she asked me to lift my shirt up, and she just put her initials on the right side because the right side was where they were gonna do the injection at for my back. And then she also gave me the sedative in my arm, and it's like a stick, sting, and a burn. And they massage your muscle like this as they're slowly putting it in, and you can feel it burning. So she said, okay, just have a seat here, and somebody will be to get you in a little bit. So I'm sitting there, and I'm like, this sedative ain't working. This sedative ain't doing this or that. But then I started like I was looking at these charts. You know how they have charts on the wall? I was looking at the charts, and I kept going. So I guess I had really like fully closed my eyes, knock at the door. This guy comes in. He had on the whole get up. When they doing radiation stuff, they had like that uh that plastic stuff on to protect them from radiation or x-rays and stuff. So he said, Miss Corley, my name is such such such. I'm going to be taking you into your procedure room. So I stood up, staggered a little bit. I guess that's why he was there. He's telling me, okay, we're going to go to the right, but my body wants to go to the... I was acting like a real drunk person. So I got in the room, put my little stuff on the table. He said, okay, you can lay on your stomach. Lay on your stomach. So I laid on my stomach. He said, lift your legs up. My feet. Lift your feet up. Lift my feet up. He put a pillow up under my legs. And he said, I'm gonna pull your shirt up. He pulled my shirt up. And he says, and I'm gonna pull your pants down. So he pulled my pants down to like midway the crack of my butt. Like almost totally exposed. So he says, you're going to feel something cold. And that was like the betadine. Because they do ask you, are you allergic to iodine, betadine, shellfish, and all that stuff. And I was like, no, I'm not allergic to anything. So after he put it on, to sanitize the area, he lifted the bed up. Well, by this time, that medicine is kicking in real good. I'm feeling nice. So he calls on the phone. He says, Dr. Khan, such and such is ready. So the doctor comes in there, not even thinking. The bed is up high. And to me, the doctor looked really, really short. And this had to be some of that sedative kicking in. I asked him the dumbest question. I said, how tall are you? He's like, I'm 5'5". And I'm like, well, you look really short. Just dumb. Just dumb. Just dumb. I guess he knew that I can't be that dumb in real life. I was just, it was the medicine kicking in. Well, anyway, it was, the side was marked. He put on like this little plastic sheath over me, and just for sterilization. And there's a x-ray machine hovering over my back. So, he tells me, he's like, first injection. So he puts the needle in, and it felt like a bee sting. But when he looks at the x-ray machine, he puts it in, but they have to be careful to go in the right space and not to actually touch the nerve. So once he goes in, he just like taps on it. He taps on a needle, and you can hear it clicking. But as he tapping, that's not too bad. That's not too bad. And then when he gets in the right spot, he'll tell you, he says, okay, now you're going to feel a lot of pressure. I'm going to put the medicine in, and you let me know if you feel it. So when he puts the medicine in, it feels like somebody's pulling on your leg. And you can feel it like going from your back to your butt, to your hips, to your thigh, all the way down your leg. So it was uncomfortable, but it didn't hurt. But I guess because I had never felt it before, I was like making some little like noises. So he got that one done, and then he put another needle in the right side, but in a different location. So, because I had this was for my L7, and this is the one that gives me the pain for my lower back, I think it is, because the L5 is on the left, and that controls the right nerve, and vice versa. So he did that because I had just had one. I knew what to expect to feel, but it still was a little uncomfortable. So after they were finished, he cleaned me off. The guy had me to sit up, and there was a young lady in the room too. And they put me in a wheelchair, took me back to the waiting room, gave me some paper, and told me no driving for 24 hours, no drinking alcohol, no walking without assistance, don't sit or stand too long, move around. I think that was pretty much it. Then she wheeled me out to the car. I got in the car, came home. I stayed up for like an hour or two once I got home, and then I just went to sleep. So today, the situation was pretty much similar, except for when I went in to get on the table, and the doctor that actually does the procedure, they have to do a timeout, what's called medical timeout in the medical field. When you have a procedure, a surgery, or anything, you got to make sure it's the right patient, the right location on their body, the right drug, and all of that. So he was calling out what my name was, what my social security number was, my date of birth. Then when he said what he was going to do, he asked the guy, why wasn't I marked on that side? He said, this is a timeout. This is what we do for timeouts. And the guy says, yeah, we normally do this in the OR and stuff like that. And he was like, well, she's not marked. And he was like, yeah, they mark them. The system was like, they mark them 60% of the time. And he said, well, they need to mark them all the time because, this is very important. He said, from now on, if the patient comes in and you see them and they're not marked, you either have her come in and mark them, or the patient has to go back. So, when you see, just like you see people that's going to have a tummy tuck or stuff like that, they take that blue marker and they do all this. It's the same thing. They just put an initial or something like that on the actual body part. Because people have had wrong limbs cut off and all that because the timeout wasn't done properly. So he asked me, I was laying flat on my stomach with my arms folded and my chin down. So he asked me to roll to my right side a little bit. so he get, I guess, so he can get a better angle of where to put the needle in. And he said you're gonna feel a little sting, and it was just a little sting, and tap 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 to make sure the needle's in the same place. He'll tap the needle, and then you hear the machine like click up, just to make sure when he takes the click up, is the X-ray machine taking the picture to make sure that the needle is in the correct spot. So he said, you're gonna feel some pressure. Let me know. Oh my child, when I tell you I felt this one, it was like somebody had poured cement, and I felt it down to the tip of my toes. It's just like somebody had took some hot sand or some cement and just poured it down my leg, and it was really uncomfortable. Like, And he said, I'm gonna go slow. If you need me to stop, stop. And I didn't really tell him to stop, but I was just, he's like, let me know when you feel it. And I was like, yeah, I feel that. And then he would ease up, and I was like, So he did that like 4 or 5 times till they got the entire dose in me. So that one, I guess they have to do each one 2 needles on each side. So when I was done, they took everything off me and wiped the Betadine off, and I was jokingly saying, if I would have known I was gonna get a scrub down like this, I wouldn't even have took a shower. But I'm glad they were so careful, because I seen some people do videos and they said that they get their clothes all messy with the Betadine and stuff like that. But that time nor this time, they didn't put they didn't get my clothes messed up. And he put Band-Aids right there where he had did the little procedure at, put me in a wheelchair, took me back to the room. I called my ride, make sure he was in the parking lot, which he was, because he didn't want to sit inside the doctor's office because of COVID and everything. So, got me a medical appointment. I have to go back in 3 weeks. Because I said, typically, how long does this take to kick in? And they said it can take about 2 weeks for it to kick in, 2 to 3 weeks at the most for it to kick in. And it can last anywhere from 6 months to a year. So, after the 3 weeks is over, if the pain is still there, then we got to look at other options. But we're going to claim that it's not going to be there. So they gave me a prescription to go back in 3 weeks. And what else? Took me out to the car. She got me in the car. Same rules, no driving for 24 hours, no alcohol, no baths, no hot tubs, no swimming pool. I can't take a shower. Same thing, no sitting or standing in one place for too long. So, my appointment was 9:15. I think I was out there by about 10:30, quarter to 11. It doesn't take long. But I'm at home now. I'm just resting and chilling. Let the medicine work and do what it has to do. And I'll probably come back and revisit this subject after I do my 3-week appointment and let y'all know how I'm feeling. And mainly the reason why I did this is because when you look at the infusions, you'll see, when you look it up on YouTube, you'll see people actually doing the procedure, the doctors and stuff doing the procedures, but you don't get a point of view from the actual patient as what they went through. So I just did this to let y'all know what I went through, and everybody's experience is not going to be the same, but I just want to share on here because maybe I can help somebody that is thinking about having one and are leery because of the needles. And believe me, I am definitely ill when it comes to needles. When I was younger, I said I ain't gonna never have a baby in my life because I ain't gonna get no shot. I know that was crazy, but I hate needles. But it was not that bad. Consider the options. You stay in pain. You have your back cut open. So I took this option. So that was my experience. Thank you guys for watching. Please click, comment, share, and subscribe. I love you guys. Smooches.